Good morning. I am Dr. Latha Chaturvedula from Pondicherry. So I'll be talking about the ultrasound probe, which is a 3D probe. Of course, in ART we always prefer a transvaginal probe, but there are certain indications where we have to do an abdominal probe. So abdominal probes are of various types. We have superficial, we have curvilinear, which has 2D, and we have a 3D probe. 3D, the advantage is we can also do a 2D examination. So this is fixed to the ultrasound machine, and we have the probe, and you have to know which is anterior and which is posterior. For that we have a marker here. Whenever this kind of thing is there, each probe has a different way. The other side will be posterior, will be a dot. You should not keep that. Suppose I want to do upper abdomen, so this has to come in the upper. If you do like this, the whole thing will reverse. Breech will turn, cephalic will turn, breech, it will be a disaster. So we need to hold the probe like this. Every probe has some frequency. So we have frequencies from 2.5, 3.5, 5, and depending on what structure we are seeing. So whenever it is for abdominal probes, it is either 2.5 or 3.5 megahertz. It's always in hertz. So that is the advantage. And the thing about this is, I said 2D. 3D is not much useful in gynecological cases because TVS is much better in those. But whenever the organ is palpable per abdomen, in those cases some 2D is enough, but sometimes you'll have to do 3D, especially for fetal anomalies. It's a beautiful thing where you can see the structural anomalies. It will not show the internal organ, but the structural anomalies are beautifully seen on 3D probe, especially cleft lip, cleft palate and those things. Sometimes, rarely, if you have to differentiate where the tumor is arising from, whether mass is arising from, whether it's from the uterus or ovary, sometimes it will be helpful, but not much of use in gynecology with 3D. So 3D is more applicable, abdominal 3D is more applicable for obstetrics more than gynae. So
I am Dr. Cherayo Parmar. I have a question. Yeah. Can you please elaborate on the correlation between megahertz and depth and clarity?
Yeah, TVS will do. Okay. What I understand is, the more the megahertz, more superficial will be able to see. That's what I'm thinking. It's inversely proportional. That's what
higher will be the frequency.
That's why I said 3.5 you'll see abdomen. If I want to look at the breast tissues or abdomen, it will be 15 megahertz. So the depth of invasion is inversely proportional to the megahertz.
So frequency has a higher frequency.
Yeah.
Clarity will be less.
Clarity is more.
Will be less.
Clarity is
Less. That's right.
More superficial.
More.
Yeah. Depth is less.
That's why TVS is more hertz, so more clarity but less depth.
Penetration will come down.
Yeah.
But the clarity will increase.
Another thing I forgot to tell is, always whenever you're doing an abdominal ultrasound, it has to be with full bladder. Otherwise, we are talking about lower abdomen because we need to delineate the uterine organ, ovary. Otherwise, from abdominal wall, we will not be able to delineate where it is from. But it's exactly opposite in TVS, where you should not have a full bladder. Then you'll not be able to see. The proximity is much better in TVS. Thank you.